Hi, this is Anand. Right now, I'm an education consultant for the past 5 years. We are doing admissions for students, giving counseling for students, those who are pursuing, want to pursue their higher studies in abroad, especially for MBBS. Why basically students are going to abroad? Why they are choosing to study their study destination in abroad? Why they were going for MBBS in abroad is most probably the cost of Indian education, affordability is very high for the lower middle class or upper middle class people. So for them, the best option is to go and study in abroad countries. Most preferably, the students will go for MBBS. Study destination will be Russia, and moreover, this and all the CIS countries, Commonwealth countries, Azerbaijan, Georgia, Belarus, Moldova, Uzbekistan, Kazakhstan, Tajikistan, Kyrgyzstan, like this, all these Commonwealth countries, the students are going for medical education. Basically, India and Russia, the Russian education. I just want to talk about the Russian education. One of the best system, which is there. They never compromise in the education system and infrastructure wise, academic wise, theoretical wise. Nothing was compromised in Russian syllabus. So because of that reason, and the living cost, for India, it's a people friendly for Indians. It's a people friendly country for Indians. Russia. It is completely safe and for especially for girl students, completely safe country that we prefer is first thing we used to prefer Russia. And the living cost is comes around only 10,000, not exceeding 10,000 per month. And moreover, the tuition fees, everything is affordable for average Indian family itself. So because of that reason, we are preferring students to choose for the because, most probably the universities ranking, which is under 196 or 1078, like that only we are sending students from India. So most preferably, entire Commonwealth countries after Soviet Union divided in 1990s, then Soviet Union got splitted only this Uzbekistan, Kazakhstan, Georgia, Belarus, Moldova, Armenia, all other study destinations that students want to choose. So most preferably, they were not able to uh, combat with other countries, not able to combat with. We cannot compare this education system. Uh, Entire education system is not that much compromised when compared to other Soviet Union countries which got divided after 90s. So our first preference, we will always used to say to for the Indian students to choose a best university, and moreover the students should choose wherever country, whichever country they are going to study. First they have to check whether it is NMC approved university or WHO approved university, and moreover not only that, they have to choose the best and government universities. Public universities is the only best option for the students, because in case of sometimes students will go for some other countries, some various countries, they will choose some private universities. If their affiliation got cancelled, then the student will be got into trouble.
And I'm sorry to interrupt you. Just
Yes.
one more added thing. Uh, uh, how to ensure that you go into the right MBBS course abroad? So you said it should be NMC approved, it should be WHO approved, it should have a hospital attached with it. These are the major things.
Yeah, these are the major things. Recently, November 18, 2020, the NMC has given a new rules. That rules specifically mentioning that 54 months of study period and 12 months of internship period. 5 plus 1 will be the education criteria. And moreover, the Indian embassy, basically earlier the NMC give a guidelines for Indian students. These are all approved medical universities in this country. But what this after 2020, this new rules came. What the NMC told is whether the university is recognized, but that Ministry of Health, whatever country they are choosing, in that country, that university should be recognized. Nothing more.
And you talk about Russia, especially you have a specialization in Russia.
Yeah.
So there are lot of countries which are associated with Russia or which are a part of the USSR. So,
Yeah.
which countries you recommend students being sent to the for MBBS programs
Apart from Russia.
apart from Russia?
Apart from Russia, Uzbekistan is there. Tashkent Medical Academy, which has been established in 1920, and Tashkent Dental Medical Institute, Tashkent Pediatric Institute, Bukhara State Medical University, and all other campuses were nearly 8,000, 5,000, 2,000 acres, like that only. The campus, building, infrastructure wise, everything is not compromised like the students who studied in India.
Okay, there are other
Other than Uzbekistan, the students can prefer Egypt also. Egypt also having very good infrastructure. The climatic condition will be similar to India, and the disease also same as India. So the population is very high. All the hospitals is having nearly 5,000 beds hospital, 2,000 bedded hospital. Patient inflow is very high, and the admission is only done by the government portal only. So like India, they can choose.
So you are saying Russia and Egypt both are equally good places
Yeah, yeah.
for MBBS. Now, there is one thing which is generally heard is that the students who complete their MBBS from abroad, they find it difficult to practice in India, or they find it difficult
Yeah,
to clear
one thing.
need PG.
Yeah, one thing we have to clear with the students. If the students going abroad, they were most of the things what the students will think is what we told to the parents is first 3 years they have to concentrate in their academics basic without because some point of time the students will only prepare for examinations point of view only, and without their parents they were fully free in some other nation, they were partying all the nights, means then those people can't clear this crack this NEET PG or clear FMG exam. In case in future if it is coming next exam, national exit exam, they cannot do.
So you want to say that even though you go to the abroad, you have to study hard,
Yeah,
very hard.
Yes. Only those students who are studying well, they are easily cracking in the first attempt itself. Until and then those who are feeling very tough means because they were only studied in the exam point of view. So that's a major problem. The students should have vast knowledge of the subject because MBBS is every day there is an updation. So the students, those who are pursuing MBBS, they have to study till their end.